The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and I hope everyone is having a great start to their Thursday so far. Thank you for joining us today for this Safe and Calm webinar, another, I guess I will say, episode to this series. Before we can get started, I just wanted to say thank you to Therapy Management, one of our preferred and valued business partners, for being part of our Safe and Calm webinar series. Since 2007, they have been creating therapy programs that uniquely mesh with the goals, brand, and personality of each senior community they serve. Their clients describe them with words like creative, flexible, joyful, charming, dedicated, and industry experts who are hands-on and high-touch. As one of Leading Age Michigan's preferred vendors for therapy services, they provide contract rehabilitation and therapy management services to skilled nursing facilities and assisted and independent living communities who are seeking a strategic partner to provide clinical expertise, business acumen, and efficient systems to enhance care, improve outcomes, and help each person live life to the fullest. Everything they do is designed to meet the unique needs of your community. Today's presenters from Therapy Management will be Donna Trzynski, an Area Manager, Rachel Malkin, an Area Manager, and Carrie Hensel, Vice President of Marketing and Sales. Before I turn it over to them, if you do have any questions, go ahead and put those in the little questions tab there, and we will go over those at the end of their presentation. Other than that, I think that is everything I need to take care of. So thank you, and I will now turn it over to Carrie.
Wow, Blake, thank you for saying all those nice things. Welcome, everyone. I'm Carrie Hensel with Therapy Management. I want to turn around and say thank you to Leading Age Michigan for all of the valuable resources and support you've been providing over the past 3 months during COVID. Also, thanks for inviting us to talk about therapy considerations as nursing homes and senior communities navigate the reopening process. A couple things that you might wonder that Blake didn't say. So we're going to make this presentation available to you. So I think Blake is going to share the PowerPoint should you want it. And then any other resources that we reference, I'm happy to share with you. You just have to reach out, and my email is at the end of the presentation. We'll save questions for the end, and we're going to attempt to do 2 polls during the webinar. So weigh in when we ask you certain questions. I will introduce our presenters. That they are Donna Trzynski and Rachel Malkin. They are both area managers with our company. This means that they oversee therapy teams at dozens, each of them at dozens of SNFs, ALs, CCRCs across the state. So they have a wealth of knowledge and a perspective that spans rehab facilities, long-term care, communities of all types, sizes, and locations, from Metro Detroit to remote and rural locations across the state. So, our agenda, let me make this go. Okay.
Also, Carrie,
yeah.
I did just want to say, I know that you were saying that you were going to share the PowerPoint. Also, if anybody is interested in rewatching the recording, on our COVID-19 page, as soon as you go onto leadingagemi.org, you click on our COVID page, and we have a recording of all of them, and we will be putting this recording up hopefully today. So just forewarning.
Awesome. Okay, so here's our agenda for the webinar. First, Blake did a marvelous introduction of our company. I'll add a few things to that. And then we're going to set the stage by talking about the experience our elders have had during COVID. Then with that context, we're going to talk about these 5 items, including CMS's proposed phases for reopening nursing homes safely, and then our own proposed plan for how residents can re-engage with therapy, including reopening those gyms that closed and cautiously bringing back concurrent group therapy. We'll also address home evals and survey considerations. And I hope that our content is so enthralling that you won't end up multitasking all that much while you're watching this. All right, So quick intro about us. For those of you who don't quite remember who we are the fun people in the wine booth at conferences. So when you come to our booth, you're all very competitive about doing a bean bag toss or a ring toss, and then many of you leave really happy because you won a bottle of wine. So maybe that jogs your memory about who we are. We are Michigan-based, and we've been growing slowly but surely since 2007. We provide contract therapy to many leading age members like Woodhaven Retirement Community and the Wellspring communities, many county medical care facilities, and then SNFs, ALs, ILs, outpatient clinics around the state. We are indeed the chosen therapy provider for Leading Age's Business Alliance, which means that we offer additional benefits to Leading Age members, and we contribute to Leading Age's educational and advocacy efforts. And then I included a quote here that I just got this week from one of our customers. It's a contract we started on April 1st. Yes, right in the middle of COVID. The administrator decided to change therapy companies because she felt like her previous company was billing her too much under PDPM, and she felt like their service wasn't up to par, and she said that the previous provider didn't provide enough support and education to her therapist. So in working with us over the past 2 months, she's noticed a big difference in care, service, and cost. So if you're worried that your current provider isn't working hand in hand with your team, and by that I mean metaphorically, because of course we're having social distancing, then if they're not working hand in hand with you, then maybe you should give us a call. And that is all I will say as a sales pitch right there. Oh, these are some of our teams from across the state over the past few months. We are so proud of the collaborative efforts we've made with nursing and administrative teams to care for our elders during COVID. What a brave new world we are now in with our customers and our dear residents. And with that, I'm going to turn it over to our esteemed and extremely articulate Rachel Malkin, Area Manager.
Thanks so much, Carrie. Hi, everyone. Thanks for joining us today. Let me set the stage for this presentation and talk about what our residents have been going through during COVID. Since the pandemic took hold, our residents have been afraid. Some have gotten the virus. Some have lost friends or family from the virus. All have been isolated from their families and friends. They're lonely. They're bored. Many are disheartened and depressed. They are likely showing various forms of decline, from functional decline to cognitive decline to even incontinence. Many residents say they don't know what is going on in the outside world. Wouldn't it be nice to get out of the unit and feel some sunshine, just to leave their room for a little bit? One of our patients has reportedly intermittently crying because he misses his wife so much, and the video chats and the outside window visits, they just aren't the same. These people can't hug their family, they can't hug their grandkids. They're fearful to come out of lockdown, and they're ready to engage, both. They're ready to get out of their rooms. They're scared, but they're ready to get out in the summer sunshine and live more active lives again. And if our residents are lonely, depressed, and in decline, then how might that affect our star ratings and quality measures? Let's take the long view. On the other side of all of this, nursing homes will still be judged on 5 stars and quality measures. Those things still matter immensely, and it's prime time to bring them back into focus. So what are some tools we can use to kind of look at this? In point-click care, there is an ADL significant change report. It's so useful. If any of you aren't using it, I definitely encourage you to take a look at it if you do have access. It identifies people in the decline. So it takes this 2-week look back period, and you can real quickly see some declines on this screen. We would expect to see declines in locomotion on the unit or locomotion off the unit while these people have been stuck in their rooms. We wouldn't expect to see bed mobility declines, incontinence declines, unless there maybe could be another contributing factor. Nice way to just quickly screen this and look for those patterns of decline. It shows you the weeks in advance and a comparison. So if we just look at that top one, week 1, we were at 2.14, week 4, we're at 4.86. That's a pretty big difference. So it might warrant, popping in there and taking a look at things. I think the key with this report is being proactive and not reactive. We can definitely catch these things ahead of time and possibly prevent falls or prevent UTIs. So nice, useful tool with that. So with that as our context, let's talk about how CMS is proposing that nursing homes reopen safely. On May 18th, CMS issued guidance about a 3-phased approach to reopening. The phases are based on 7 factors: how much COVID-19 is in the external community, the extent of spread inside the nursing home, the nursing home's ability to staff, your ability to screen, test, and provide PPE, and your local hospital's capacity on wards and in the ICU. We evaluated these recommendations and determined our own approach to returning to regular therapy services, of course, in alignment with our customers and our facilities. I won't go into depth on this, but we can certainly share these tables with you guys. Our team looked at the visitation and service considerations for each of CMS's 3 phases, as well as what surveyors will focus on per phase. We determined that if CMS was recommending reintroduction of communal dining, the reintroduction of activities, and eventually the reintroduction of visitors in facilities, then these considerations would help us determine how to adapt our therapy practices. Our team highlighted changes between the phases in red. You can see some of them here. For example, in phase 2, group activities can resume to a certain extent. So we asked ourselves, is phase 2 the right time to bring back group therapy? If so, to what extent? And in phase 3, visitation by families will be allowed with proper PPE, screening, etc. So how might that change what we are doing therapy? So next we'll go deeper into the therapy considerations for each phase, but we wanted you guys to see how we arrived at our recommendations. With that, I'll turn it over to Donna, who will take a deeper look at these phases.
Great, thank you, Rachel. So based on what CMS recommended, here's kind of what therapy management is recommending for therapy per phase. In phase 1, which all nursing homes are really in right now, we are still very restricted, we're very cautious. Our goals during phase 1 are, though, to get the therapy gym in tip-top shape to reopen. Although I do want to say that some gyms never fully closed during COVID. And I do have a story. It was a readmit with a new stroke. And it was during that time, the very restricted time in April, the beginning of April. We had to develop a plan in collaboration with the facility to not only strategize a route for him to get to and from the gym, but we also had to make sure we maintained all of the infection control and maintain the CDC guidelines. And I'm thrilled to tell you today to report that this man, thanks to those collaborative efforts, he now went from a total assist that could not stand to, as of last week, walking 50 feet with a platform walker. That is just a really huge positive that we have from, working together, therapy and the facility, and making it happen in these really stressful and challenging times. Of course, we're going to continue to be vigilant about screening, testing, infection control, proper PPE, hand hygiene, cleaning our workspace, gyms, cleaning the equipment, staying in accordance with all our facilities and CDC guidelines. We will continue to use caution with residents with COVID and those with symptoms. So we may continue to do room treatments with them as it's clinically appropriate. But with approval from our facility partners, we may and will begin to do some concurrent therapy with social distancing and maintaining all precautions. Please note, the decision to do concurrent will always be on a case-by-case basis in alignment with each facility. And we'll make sure our teams are ready for surveyors focused on infection control. Now, we are on to our first poll. Blake, are you gonna?
Yes, so I will go ahead and pull that up right now. Let me get 1 second. All right, so I will launch that. Everybody can go ahead and choose yes, no, or I don't know. We'll wait maybe for, how long do you guys think? 30 seconds, something like that?
Sure, yep.
And then once that's done, I will go ahead and close the poll, and we should be able to see the responses and how everybody responded with that.
Great, thank you. curious to see.
All right, so if you haven't voted yet, go ahead and vote. We'll give it about another 20 seconds. It looks like we've had about half the people vote in here. So yeah, we'll give it 15, 20 more seconds. Just yes, no, I don't know, and then we will go ahead and review that. Thank you very much.
Thank you, Blake.
All right, well, it has been about a minute, so I'm going to go ahead and close this one now, and then we can go ahead and share the results from that. And so those are the results, 46% saying yes and 54% saying no.
Very interesting. Thank you, everyone, for answering that. And, you know, it really kind of fits what we're seeing out there. Some of our customers, gyms closed during COVID, and some did not. We also, there was, you know, there's a therapy group across, it may even be the whole United States, just kind of having that discussion, and it seemed about 50-50. So very interesting. Thank you. But for those that are just reopening, our therapists are reporting that people are excited because they can use the equipment and they feel like they are getting better faster. You know, as we're working with our therapy teams across Michigan to reopen the gyms, we're making sure that, you know, there's things that we are covering. You know, we're making sure that they all know the max capacity of their gyms so they can determine how to account for social distancing around equipment, and for various activities. Some have had to rearrange equipment. We're ensuring that our workstations have proper distancing. And that being said, some workstations have had to be moved to an entirely different space depending on the structure of your facilities. You know, some are quite large, some quite small. It really just depends. So we all had to make sure we work together and continue to do so. Our teams are making sure that we have hand sanitizer in place for gym entry and exit. Many also have sinks in the gyms and near the entry and exit doors. So we just have to kind of accommodate and figure out, you know, what is the best practice per gym setup. Our teams are also reviewing their infection control policies, standard precautions, and cleaning logs, so they are ready for survey. Which brings me to survey. So we developed here a little questionnaire that we did last week with our program managers to make sure they were doing their homework and preparing their gyms. Our managers posted their answers to these 6 questions using Microsoft Teams function, which is what we use to communicate across to all of our teams. I'm very, very thrilled to report they were all able to answer yes to these questions. But then what we did was a little raffle, and one of our teams won Amazon gift cards, and it just brings a little fun and competition to our efforts. So please feel free to utilize this if you need to. It's just kind of a good way to make sure that they're really thinking of what they need to do, not only just daily, but just in preparation for survey. With some of our partner facilities, residents have been returning to the gyms. However, some are a bit scared to leave their rooms. Once they get over the trepidation, they are so happy to re-engage with therapy. You see here a few quotes from our residents. We love our Roger. He literally didn't want to leave his bed because he didn't see the point. Now that he's back in therapy in the gym, he feels like he has a purpose to his life again, and he can work on building his strength. And of course, as therapists, there's nothing we want more, any of us as healthcare providers. Moving on to phase 2. Now this phase is a wee bit less restrictive. Everything pretty much stays as vigilant as phase 1, as you can see with 1, 2, and 3 here. But CMS says group activities may resume with distancing and no more than 10 people. So here in this phase is where we feel some form of group therapy could begin. Later on in the presentation, we will discuss more in detail the group and concurrent therapy, but surveys will continue to focus on infection control here also. Now phase 3, restrictions are relaxing a bit more, but we're still using precautions. CMS says in this phase, now visitors will be allowed to return to the nursing homes with proper PPE, screening, and infection control. But for therapy, what does that mean for us? We're going to feel like family members may be able to return to the gyms and attend therapy sessions. During this phase, surveys will quote unquote return to normal. But of course, there will be focus on infection control, as there always has been, and more enhanced now. So now I'm going to turn it over to Rachel so she can talk a little bit more in depth to you about concurrent and group therapy.
Thank you, Donna. Yeah, let's talk and dig into considerations for group and concurrent therapy status post this COVID pandemic we are in. As a quick refresher, concurrent therapy is when one therapist treats 2 Med A patients at the same time. Those patients may or may not have similar goals. For example, a therapist would start treatment directly with the patient beginning a certain task. Then once the patient can proceed, the therapist would start a second patient on a different task while continuing to supervise the first patient. As we considered if and when to bring concurrent therapy back, we did our research. The APTA and CMS haven't provided definitive answers yet. We surveyed one of our industry groups. Half the respondents said they never stopped doing concurrent. The other half of the people said they quit months ago and haven't resumed, which kind of goes in line with our first poll, the half and half, with half of the gyms being open and half the gyms, not being open yet. We're seeing this mix of this. So concurrent therapy can be important and beneficial for appropriate patients. It's good for people's sense of camaraderie and normalcy. Some people feel challenged to push themselves a little bit more when they have a workout partner or somebody encouraging them. Concurrent is also practical and efficient for a therapist to supervise 2 patients. We empower our therapists to use good clinical judgment when deciding who will really benefit from concurrent therapy. We also ensure that our therapists are fully in line with the wants, needs, goals, precautions, and the philosophies of our facility partners in regards to concurrent. Concurrent would be appropriate for patients in the gym, depending on what CMS phase we were in, or if patients shared a room. They need to be able to do a task without continual supervision or the need for hands-on assistance. And of course, there will be 6 feet or more of distance between those working concurrently. We'll avoid concurrent treatment in these circumstances and or at the discretion of the facility. We would not have a therapist doing an ultrasound on Mr. Smith's left knee with his left hand and doing another ultrasound with the right hand on the other side. So our teams are trained to embrace a collaborative approach to care, and our therapy program managers always plan with facility teams for concurrent therapy. We do have a little image on this slide. It's a handout that we use with our managers to talk about concurrent therapy with their administrator teams and leaders. Carrie will have access to this handout if anybody wants this. I know Blake, you guys talked about uploading that, so thank you for doing that. And now we're ready to roll into our second poll question. Blake?
All right, I will go ahead and pull that up. Give me 1 second. Let me go ahead and launch that. So again, we'll just wait. We'll wait about 1 minute. Let everybody get their votes in, and then we'll go over from there. Thank you. All right, we'll give it another 15, 20 seconds here, and then we will go ahead and close. So if you have not voted, just feel free to click on yes, no, or I don't know, and then we can go over the results from here. All right, so it doesn't look like anyone else is voting here, so we will go ahead and close this and share the results.
Okay, great. Thank you for that, Blake, and thank you for those participating with that, that process. Yeah, so let's go ahead and talk about group therapy next.
Oh, wait, hey, Rachel,
Yeah,
sorry, just chiming in here. It's really interesting. No one in the poll is doing concurrent yet. So, or if they are, they don't know that they are. So just thought I would point that out.
yes, interesting. And thank you, Carrie.
Now let me get this back on track here. Hold on.
Okay.
All right.
Great, great. We'll talk about a quick refresher about what group therapy is. It's a therapist that can work with up to 6 people on a common skill, like exercise, fall prevention, or cognitive exercises. Many people benefit from group because it's a social activity and fun. Group therapy allows residents to perform in a more active environment on more functional activities. Therapists can observe how people perform in group, and this aids in their assessment of a person's readiness for discharge and or the need to modify a person's goals or plan. Someone's ability to complete a task in a quiet room without distractions is going to be different than someone's ability to complete a task with multiple distractions and other people around them that may distract their attention. It allows therapists to do that real life scenario. We're still going to be cautious about this. We're going to maintain hand hygiene, appropriate PPE, social distancing, not sharing equipment, not be appropriate to sit in a circle and everybody throw a ball around. It would not be appropriate for residents in observation or isolation or some of those residents coming on and off different units. So just things to think about. We'll now turn it back over to Donna, who will talk about some other considerations.
Thank you, Rachel. Yeah, I'd like to now talk a little bit about home evals and survey considerations during the reopening phases, during each phase. Now, we've already been doing home evals on a case-by-case basis. We do request that the caregiver participating in the home eval is masked and screened. Thus far, and during phase 1, our therapists doing the evals are in full PPE. We ask that the family dispose of the PPE after the evaluation. Our therapists bring along a trash bag to put the PPE in for disposal. We really highly recommend and encourage double masking. However, as you all know, some residents or diagnoses cannot tolerate the mask. If you can, highly recommend it. Otherwise, we proceed and again, still follow these continued precautions with full PPE and the caregiver screening and mask. Our therapists also carry hand sanitizer for use when they get back into the car. Of course, we train our therapists to always err on the side of caution. You know, they need to consider all guidelines. You know, they need to know where they're going for the eval. Are they being asked to go into a hotspot? I mean, even though the nursing home that the patient came from may have few to no COVID positive patients, where's the location of where they live? So we definitely take all of that into consideration, you know, which then what is the risk of doing the home eval versus the reward? Of course, as therapists, we always want to. We want to go to the home. We want to make sure everything's safe. We want to make sure the family's well educated. You know, we just got to take into consideration these times and what's going on, just as any time, really. If they're doing the home eval, we say, please do it at the end of the workday. You know, we schedule it then so they don't return to the nursing home and cross-contaminate, so they can get home, so they can, you know, unrobe and shower and all of that. And if we determine it's just too risky, are there other options? Maybe we can just do a type of assessment, via Skype or via FaceTime, or just show us some pictures of where you live, anything that can give us therapists a little bit more insight into the home setting so we can at least give the best direction to the family caregivers and the patient. Now, I do want to talk a little bit about preparing your therapy team for survey and how we help to prepare them too. This will be our last slide before we take any final questions. So I know we're going to answer questions hopefully at the end here. But surveyors are focused on different areas during the 3 phases of reopening, it seems. Most of your facilities, they've probably received an infection control focused visit from surveyors of some sort. If not, it's probably coming. Our customers, they're all getting all these types of surveys. I mean, as we know, penalties have gone up for infection control violations. We have an example of, frustrating one that we had a patient return from the hospital, no COVID signs or symptoms, and they're attempting to cite them in IJ right now for not isolating the patient for 14 days. Now that's being disputed. And, I think it just, again, reiterates, we are all entitled to the proper education and regulations as to how to handle all of this. And in this case, the facility, and does not feel that they did anything wrong, nor did our therapy team, in how they handled this resident. And we really, stayed a very late night, trying to discuss where is this regulation or this guidance. So it's just, I just wanted to share that because I'm sure all of you are dealing with things on different levels. And, we just got to work together, and it can be frustrating, and and it can be rewarding too, and good lessons learned from some of this. Oh, sorry, was I supposed to shut up for me?
No, so, I'm so sorry, Donna. Sorry.
Okay, sorry. I'm like, am I over time? I'll try to keep.
No, you're perfect. You're perfect.
So here's some things that we're doing with our teams during these infection control focused surveys. We are definitely making sure that our policies and practices are updated and available constantly. Our teams are educated on those policies and practices. We have a system to track any changes and keep our partners updated every single day. We communicate with our teams using an online platform. It's called Microsoft Teams. We've also hosted something called TMI Team Talks via Zoom. We do this to keep our teams up to date. And in the first 6 weeks or so, we did this daily. Now we do these talks weekly, so our teams know where we are headed, and they can also share questions, best practices, and stay informed. It's really been helpful. And these TMI Team Talks, they're just something I feel we will continue well into the future to use even when we are past this pandemic. So I think we're going to now turn it over to questions, and thank you all for your time today.
Hey, Blake.
Hey, Carrie. Let me go ahead and.
Oh, unfortunately, Rachel got kicked out of the meeting. And it says, I don't know if she said, well, she got kicked out. So if the questions are too hard for Donna and I, then we will follow up with answers.
Okay, that's it. Sounds good. Yeah, I don't know why that happened. I'm sorry about that. So the only question that I have is, will we have access to the slides after? I was trying to add these slides. It doesn't look like your email came through, Carrie.
Okay.
It could be maybe because it's a bigger document, so maybe try to send it to me as a PDF.
I'll do that.
So yeah, we can go ahead and get that out to you guys, or if you want it, feel free to email myself, Carrie, Donna. If you do want it, you can email me though, Blake, BLAKE @leadingagemi.org. or you have Carrie's email right down there as well, and I'm sure she would be happy to send it over as well. Other than that, I am not seeing any other questions. So right now, I would like to say thank you again to Carrie, Donna, and Rachel for being with us as presenters today, and thank you to Therapy Management for generously supporting our Safe and Calm series. We would also like to thank, I believe we were in the mid to low 30s for our members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything that you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. Just a quick reminder that we do have another COVID-19 webinar tomorrow morning at 11 a.m. with Deanna Mitchell. And anything else, we also have other education events coming up, so you can go ahead and look at leadingagemi.org and just go to our events calendar and you can see everything coming up. Other than that, I think that is everything. So Carrie or Donna, did you guys have anything else that you'd like to say?
Just thank you, Blake, and thanks Leading Age for all the important work you're doing, and thank you facility teams on the front lines. We are totally honored to serve with you and help you fulfill your important missions, so thank you.
All right, thank you. Thank you very much, both Carrie and Donna. You guys have a great day, and everyone else have a great night. Hope to see you all soon.
Great. Thank you all so much. Thank you, Blake.